I'm Dr. Bill Kelly. I'm the Medical Director here at St Vincent's and Mercy Private. We're a Catholic, not-for-profit hospital that's committed to providing safe and high-quality care to our patients. One of the biggest problems that hospitals in Australia encounter is the spread of infections. As you can imagine, health professionals often use their hands during the care of their patients, whether it be doctors, nurses, allied health professionals such as physiotherapists, or pastoral care staff. Our hands touch everyone and everything, and they become fantastic transportation mediums for germs to go from one sick person to the next. Hygiene is a very important procedure that all health professionals should undertake to decrease the incidence of hospital-acquired infections.
We have level 1A, the highest level of medical evidence to suggest or to prove that indeed hand washing significantly reduces the transmission of infection within hospitals. The evidence goes back to the 1850s when Ignaz Semmelweis, an obstetrician at the Vienna lying-in hospital, was able to show with a prospective randomised trial by washing hands that it was possible to significantly reduce the incidence of severe infection in pregnant women delivering in that hospital. Since then, further evidence has been accumulated that supports that view.
Patient safety and avoiding harm is a very high priority at St Vincent's and Mercy Private. The Board of Directors and the executive team strongly support initiatives to minimise infection rates. We have a dedicated infection control team. Through their diligent surveillance, education and use of the very best infection control products, we have achieved very low rates of hospital-acquired infections. Hand hygiene is a very high priority at St Vincent's and Mercy Private, as it prevents the spread of unwanted infections.
When we're fit and healthy, we can defend ourselves against many germs. However, when we're unwell or we've had an operation, our defences are down. Our nursing staff look after many patients. Therefore, it's paramount that they undertake hand hygiene before and after contact with patients or procedures. This can be done through traditional methods, using an antibacterial soap and water, or by the use of an alcoholic hand rub.
This is the alcoholic hand rub that we use at St Vincent's Mercy Private. It has a foam formulation that's rapid and convenient to decontaminate the hands. The product has been shown to be 99.999% effective against killing microorganisms. It's safe and easy to use, and it also has a moisturising property for the hands. To ensure adequate use of the product, we need to make sure that our hands are not visibly soiled, and then squirt about 3 mils or a size of a 20-cent piece of the foam into your hands. And then rub the foam over the entire surface of the hands, ensuring that we get in between the fingers and the wrist area. Continue to rub until the content has dried. There are 5 moments when we require staff to perform hand hygiene. These are 1. Before touching a patient. 2. Before a procedure. 3. After a procedure or bodily fluid exposure. 4. After touching a patient. 5. After touching a patient's surroundings.
Because St Vincent's and Mercy Private Hospital takes infection control and hand hygiene so seriously, we've sent members of our infection control team to hand hygiene workshops organised by Hand Hygiene Australia and also participate in their nationwide audits. We also perform internal audits on our staff, and St Vincent's and Mercy Private is the first hospital to have a doctor participate in Hand Hygiene Australia's programme and have him certified as a gold standard auditor. This has encouraged the practice of hand hygiene amongst our medical practitioners at St Vincent's, and you might spot a member of our audit team on the wards if you're lucky.
Now, let me take you through a typical patient's journey through one of our hospitals and show you when hand hygiene should be observed. Soon after registration at the front desk, a patient heads towards the clinical areas of the hospital, starting with the elevators. There are alcoholic hand rubs next to the elevators, and we recommend anyone coming into the hospital starts performing hand hygiene at this point. When you get to the ward, you start coming in direct contact with our healthcare professionals. They will need to get a history from you, examine you, and occasionally provide medications and perform procedures on you. This is where hand hygiene plays its important role. Before a member of staff touches you, they will need to clean their hands. If you do not see them do so, please do not hesitate to ask whether hand hygiene has been performed. If you have come in for surgery or a procedure, please be assured that our theatre staff and medical practitioners are supportive of hand hygiene and will endeavour to maintain our hospital's low infection rates.
Working at a big hospital like St Vincent's and Mercy Private, it's extremely important to take care of hand hygiene. There's a lot of literature linking infection rates with hand hygiene. As a surgeon, I come into contact with lots of patients throughout the day, both on the wards and in my office, and it's always important to wash my hands between patients. I come in contact with open wounds, and again, it's very important to keep my hands clean. Before any surgical procedure, we have a period of scrubbing for 5 minutes before the first operation of the day, and then for at least 3 minutes for all of the other operations that we undertake.
When you get back to the ward, nursing staff and possibly allied health personnel will be involved with your care. They are also expected to adhere to strict infection control recommendations. Hospital staff, such as pastoral care workers and volunteers, are also encouraged to perform hand hygiene. Let me show you some examples of good and bad hand hygiene practices. This is an example of good hand hygiene practice. The nurse in this scenario performs hand hygiene in between patients. This is another example of good hand hygiene practice. This physiotherapist has performed hand hygiene both before and after touching the patient. Many minor procedures occur in the ward, such as taking blood, inserting an intravenous cannula, or having a lumbar puncture. It is especially important to observe hand hygiene at these times, as they will create open wounds for germs to get into potentially. This is an example of bad hand hygiene practice.
Thank you. Hi, sister.
You can let him some pockets.
I'm just going to come and do your dressing quickly. Is that okay with you?
Yes.
Okay. I'm going to look at the wound first, and then I'll bring my trolley and things in after that. Fine?
Thanks,
Okay,
Christine.
no worries. Okay, sister, let's just
You got a bit of a cold.
Just a bit of a sniffle. Not much.
Not
Okay, sweetheart? Okay.
Can you notice what was missing? Hand hygiene is not only important for healthcare workers who have direct care with the patients, but also for patients themselves and relatives and friends who visit someone in a healthcare facility. It is very important that you clean your hands to prevent germs acquired outside getting transmitted to your loved ones. Hand hygiene should also be performed after going to the toilet, after blowing your nose, after smoking, after handling or patting animals, before, during and after preparing food, when your hands are visibly dirty.
It's also really important that patients and their visitors engage in good hand hygiene.
In fact, hand hygiene is so important in hospitals as well as out in the community that Beth Wilson, Victoria's Health Services Commissioner, has written a song and got a band together to promote clean hands at St Vincent's and Mercy Private. As you can see, hand hygiene is very important at our community, so please help yourselves, and next time a staff member comes to touch you, ask them, have you performed hand hygiene? Hand hygiene, because we care.